Good morning, Meridian. Take two. So we're once again doing our Business Buzz program this morning to share with you our guest today. I made a mistake in our setup. Kirsten's off today, so she's usually the one keeping me on track. So hopefully our sound is working properly now. I think I've got it set right. But joining me today is Nicole Claiborne with Terrace Health. Welcome, Nicole. Thank you so much for joining us today.
No problem.
Yeah, we all got to see her earlier. We just didn't get to hear her. So, Nicole, tell us, what is Terrace Health?
Terrace Health is a healthcare company that provides home care, home health, and hospice services in our patient's home.
Okay. The services that you just talked about, tell me the difference between home care, home health, and hospice.
Yeah, so that can be really confusing for the community. Home care, also called personal care services, provides trained caregivers or CNAs to assist with activities of daily living in our clients' homes. And that's pretty much what we do for ourselves every day. Getting up and getting ready and putting ourselves to bed at night is really what we help our clients with. And that's bathing assistance, dressing, making sure that they've had their medications, picking up their medications from the pharmacy, assistance with grocery shopping, services like that.
Yeah. And these services aren't something that is required to have a doctor's recommendation on.
There's not. Okay. They can call our office, a patient or family, at any time to request our services. We come out and do a free assessment, and personal care services can be provided daily and up to 24 hours a day. It's really to also provide assistance to the family caregiver as well to help them reduce any burnout that they may be feeling.
Okay. And then the service of home health, tell us a little bit about that. What does that entail and what's the difference?
Yeah, home health, unlike home care, is intermittent care services. It's rehabilitative, where they really focus on one or two specific care goals after an illness or injury. Those services are provided by licensed care clinicians. So that's your registered nurse, licensed practical nurse, occupational therapists and their assistants, physical therapists, their assistants, social work, and bath aid services.
Okay.
And really it's to get them back to baseline, get them back to independent and what they loved and enjoyed to do prior to that illness or injury is what home health is targeted towards.
And then the next service that you mentioned, hospice, very important component of your life cycle and making it comfortable for that person. Tell us a little bit about that service and what you do.
Hospice is a really special service. All of our services are great, but hospice is very special. It takes a holistic approach to patient care. So not only focused on the medical aspect of the patient care, but also their emotional and spiritual support for the terminally ill. And it's really kind of wraps around the family and their loved ones. We offer bereavement for them as well after the patient's passed away.
Yeah. We had the very fortunate opportunity when my mother passed a few years ago to have hospice care in the home, made her very comfortable and really gave us, the family, an opportunity to spend quality time with her. So hospice care is just amazing.
It is.
Yeah. So what makes Terrace Health unique?
Terrace Health, not only the services that we provide, which we mentioned, which is offering that full continuum of care service, the home care, home health, and hospice, we also have a really unique program that's called Transition to Home. And that program is targeted basically being in the right place at the right time at the time of crisis. We help family and the patients transition from a hospital setting or another serious setting like a skilled nursing facility, and we help them transition from that facility home safely. Okay. We want to keep them home as long as possible. We want to keep them from readmitting back into the hospital. Everyone wants to be home. And so that's really what Transition to Home focuses on. We are looking at their entire care needs and the social determinants of health there.
So getting them from the hospital to home, do you all come into the home, make sure everything's set up and ready for them as well?
We do. Yeah, we do a full safety assessment to make sure they have everything they need to return home and be there safely. In addition to those full continuum of care services that we offer, our staff really sets us apart and makes us unique. We have very experienced clinicians. We are constantly working towards continuing education. We want to make sure that their specific training is really targeted towards patients and their needs.
Okay. What are some ways that a client or patient can request Terrace Health services?
So for home care or personal care services, that can be requested just by calling our office or filling out our kind of brief information on our website, and we'll come out and do a free assessment. For home health and hospice, that's a little bit different. It does require a physician's order. So if that's something the patient or their family feels would be appropriate, they would need to contact their primary care physician, and that physician would write an order for home health or hospice, at which time that order would go to our office, and we would go out at a time that works for the family and the patient to discuss our services.
Okay. And how are these services paid for?
They can be paid for. So for our personal care, home care, it can be private pay, or we're contracted with the VA, as well as some long-term care insurances will cover personal care services. For home health and hospice, it's private pay as well, can be used to pay for those services, or other types of private insurance.
Okay. What about Medicare and Medicaid? I mean, do they cover some of these services?
So Medicare will cover the hospice and home health. Medicaid will cover personal care services. Unfortunately, Medicare does not cover personal care services at this time.
Okay. How does someone learn more about Terrace Health and the services that you offer?
Again, they can call our office at 208-506-7200, or reach out to us on our website, which is www.terracehealth.com.
Yeah, excellent. New chamber member, welcome to the chamber family. We really do appreciate you joining, and hope to get you integrated into our business community here. Part of that is having a ribbon cutting, and you've got one coming up.
We've
got your ribbon cutting scheduled for August 9th. At 3 p.m. Tell us a little bit about what you want people to come out and see at your ribbon cutting.
Yeah, we're very excited about it. We hope everyone comes out. It'll be at 3 o'clock on August 9th, as you said. We're going to kind of join outside of the Brighton building, and we'll move upstairs and have snacks and drinks and talk about our services and how we can help best serve the community.
Yeah, no, I think it's, great services. At some stage in your life, or your parents' life, or someone in your family, these services are going to be instrumental in helping get them back to a certain point of health, or to, make it very easy on the family.
Absolutely. Yeah.
So,
and that's, again, when you talk about what makes us unique, we're helping anyone as young as pediatrics all the way up to geriatrics. And like you said, it's to keep them as independent and comfortable as possible in their home.
Yeah. Well, Nicole, thank you again for joining us. And take two.
Yep,
I think we still covered everything we wanted to talk about.
We did.
So thank you for coming in, and we hope everyone can join us at the ribbon cutting event August 9th once again. We've got some upcoming chamber events that we want to make sure we tell you about. We just completed our after hours for July, and had a great turnout. About 100 people turned out last night at CTC for that after hours event. Your next opportunity is our first Friday event on August 5th at Big B Coffee. Come out and enjoy some networking at 7:30 in the morning on August 5th. And then our final thing that we want to talk about is August 12th is our Queens of the Greens ladies only golf tournament. There's a few team spots left, a few sponsorship opportunities for this first ever event. And we want you to be able to come out and enjoy that event as well. Until next Tuesday, when we bring you the Alzheimer's Association here on Business Buzz. Meridian, have a great weekend, and stay cool. Thank you.